Hello, everyone. My name is Jim Kite, and I'm the Dean of the School of Hospitality and Tourism, and I'm your host for today's breakfast. I'd like to welcome all of you for joining us so bright and early for this, our first Future of Health and Wellness Speaker Series event. This series is in partnership with the Champlain Local Health Integrated Network, and the purpose of these events is to share ideas, spark conversations, and discuss matters of relevance to the future of health and wellness across our community. I'd also like to welcome our online viewers who are joining us via web streaming, and let them know that they can ask questions or share comments by clicking on the small word bubble at the bottom of their screens and sending us an email. And those of you who are into social media and you'd like to tweet, the hashtag this morning is #HealthyLiving. That's #HealthyLiving. So I hope you all enjoyed or are still enjoying the wonderful healthy breakfast prepared by our chefs and students of our culinary programs this morning. I don't know who carved those watermelons over there, but I want them carving my pumpkins at the end of the month. It's amazing, absolutely amazing. And there's plenty of food left over. As I say, breakfast is the most important meal of the day. Eat like a king or a queen for breakfast, a prince or princess for lunch, and a pauper for dinner. So make sure you certainly load up. This facility, the Restaurant International, is actually a classroom for our hundreds of students who are preparing for careers in the food and beverage industry. It's a perfect example of both the interdisciplinary and work-integrated learning. It's also an example of the vision Algonquin is planning for the training and education of tomorrow's health and wellness workforce, which we'll hear a little bit more about after our guest speaker. And so now it is time to begin our agenda, and I would like to invite our president, Cheryl Jensen, to please come forward and introduce our keynote. Cheryl?
Thanks very much, Jim. Jim's a little taller than I am. I had a student come in to see me yesterday. He wanted to come. I thought it was pretty cool, actually. He said, can I have 15 minutes of your time to talk about leadership? And I said, sure. So I came out and met him, and he said, oh, I thought you'd be taller. So thanks, Jim, and welcome everyone on behalf of Algonquin College and on behalf of our Board of Governors and our Chair, Catherine Leroux, and our co-sponsors this morning, the Champlain Lin. Before I introduce our speaker, I'd just like to take a moment and thank the Champlain Lin for partnering with us for this speaker series on the future of health and wellness. As Jim mentioned, this restaurant is also a classroom, and it is training the hospitality workforce of tomorrow. With health and wellness care moving to a more community-based, prevention-focused, and patient-centered approach, we are going to need more facilities like this classroom to help train the workforce needed to address this shift in care, as well as to address the impending worker shortage in hospitals and other critical care facilities. You know, at Algonquin, we currently educate a significant component of the healthcare workforce within the Champlain Lin. So in our minds, it was critical that they be a part of the conversation of the future of health and wellness. And so we are very pleased and thankful they agreed to partner with us on this speaker series with Algonquin as the convener. This series is an important opportunity for all of us to hear about the challenges and opportunities facing health and wellness in our community. The Lin is an organization with a mandate to improve the health system at a local level while also working toward provincial priorities. And so we are all very pleased that their CEO, Chantale Leclerc, has accepted our invitation to be the first keynote speaker for the series. Chantale has been the Lin CEO since October 2011. She joined the Lin in 2008 as Senior Director of Health System Integration, where she was responsible for a number of key initiatives. Her 20-year healthcare career has spanned across various health sectors and in roles related to clinical care, research, education, professional practice, and senior administration. Prior to joining the Champlain Lin, Chantale held the position of Chief Nursing Officer at SCO Health Service, now known as Briere Continuing Care. She holds a Master's of Science from the University of Toronto and graduated from the Wharton Fellows Program in Management for Nurse Executives. Chantale has published articles in peer-reviewed journals and received several leadership awards, including an Award of Excellence from the Ontario Hospital Association. And it is our good fortune that she is here with us today. And so it is my pleasure to welcome to the stage Champlain Lin's CEO, Ms. Chantale Leclerc. Chantale.
Thank you. Thank you so much, President Jensen. It is absolutely an honor to be kicking off this wonderful series. And I was so pleased when I got the phone call from you to see if we'd be interested in hosting this event. And I said, of course. Oh, my goodness. Thank you. This is an incredible institution. I have always been impressed by the work that Algonquin College does, and I've had opportunities to partner with them on different initiatives throughout my career here in Ottawa, and can honestly say that I've been around community colleges in other places I've lived, but I've not yet come across one that is so in tune with the needs of our community and so responsive. So it's an absolute delight to be here. And thank you again for the opportunity to co-host this exciting series with you. I'd also like to thank you, Dean Kite, for hosting and for opening up your beautiful space to us. And my sincere thanks and congratulations to the students. That spread was phenomenal. Honestly, congratulations. It's absolutely impressive. I am a big foodie, big time foodie. So this has lots and lots of stars in my book. How is everybody? Good. I do have genuine concern for how you're doing. But I'm also just trying to get a pulse of how the room is feeling this morning to see how far I'm going to be able to push my comments today. I'm always very cognizant at these types of events where food is involved, that you have a range of objects at your disposal that would make very good projectiles. So I'm trying to make sure I don't offend anybody. I'm pleased to be here this morning. I'll just introduce you to Jean-Pierre Boisclair, who's the chair of the board of the Champlain Lin, and also Linda Ramsey, who was sitting at this table. Oh, there she is, Linda Ramsey, who is on our communications team. So I always travel with a posse. We're not a lot of us at the Lin, but it's nice to have the colleagues here, and you'll have an opportunity to meet them, hopefully. So really the purpose of this series is to create an opportunity for our community to think about health and healthcare, and maybe to think about it in a different way than we've been thinking about it in the recent past. And really to start to think about how collectively we're going to address the forces that are at play, and they're going to change the need of our community for health, health-related services, and health care. So I'm going to plant some seeds for you to think about and really share with you where we at the Champlain Lin, in partnership with all of you, think we need to go over the course of the next couple of years together. And in preparing for this talk, I started thinking about health in general. I was thinking about my health, actually, our individual health and the health of our collective population, our community here. And I was trying to think how I would approach this talk and whether I'd go down the road of talking about whether I thought we'd be healthier in the coming years or whether we would suffer from poorer health. And there's actually good data out there to support both worldviews, depending on who you read and what statistics you're looking at. And I guess it also partly depends on whether you're an optimist or a pessimist. Just one example, the rate of strokes in our community has leveled off in the last couple of years. which is surprising if you think that our rates of obesity and inactivity have been going up. So either we're getting better at preventing the second stroke once somebody has had one, because we have done a lot of work in secondary stroke prevention, or we're actually getting better at preventing the first one in the first place. So we're looking at that. But there are trends, like I say, that point you in either one of those directions. I was also reflecting on the fact of the degree to which our healthcare services can actually change our health outcomes. So can healthcare actually make you healthier? Or rather, whether our health system needs instead to be better able to adapt to a changing health profile of our community. So it's a bit of a chicken and egg situation that we're in. I actually concluded that for those of us who work in healthcare and for all of you that influence health, we need to be trying to make people better through our healthcare services, but we also, and we must, get better and faster at adapting our healthcare system to the changing needs of the population we serve. And I'm going to come back to that thought a little bit later. It absolutely is not lost on me that as someone who works in the healthcare world, a lot of what I do has, at the end of the day, very little bearing on the actual health of individuals. There are many of you in this room that have a far greater impact on health. Those of you who work in education, in housing, in recreation, in the food industry, in community programs, probably will have a much greater influence on people's health outcomes. Having said that, it is important that our healthcare system is the best that it possibly can be, and that it's there to help people stay healthy to the degree that we can, that it is there to help people recover from illness or injury, that it's there to help people cope with chronic illness and diseases that they might have, and in fact that it's there to help people have a good death when the time comes for that. So we at the Champlain Lin are one of 14 Crown agencies. We're not-for-profit corporations that were really meant, when we were created 10 years ago, to bring planning, funding, and oversight of healthcare services to the local communities that use those services. So the beauty of a LIN is that you can pick up the phone, you can come to our office, you can meet with the people that live and use healthcare services in the region just like you do. So we have a vested interest to make sure that our healthcare system is the best that it can be, because we use it too, and our loved ones and our neighbors use it too. So we are really well positioned to be able to work with all of you to make the kinds of changes we need to in our region. We manage a budget for healthcare of about $2.6 billion, and we fund hospitals, long-term care homes, home care services that are provided through the Community Care Access Center, the CCAC, community support service organizations, community mental health and addictions services, and community health centers. That's half of the provincial budget for healthcare services. So we have a pretty big job and a big responsibility, and it's one that we take very seriously. So we've been looking at what's coming down, what we will be facing together with you in the coming years. And there are a number of forces that are at play, and you know them, so I'm not going to dwell on them, but I will mention them just to highlight some of the other comments that I'll make. You know that our community is changing and that the demographics are changing. And when I say that, people automatically think, oh yeah, the population is aging. And I won't put up the stats or tell you by how much we are aging, but we are definitely aging. But it's important to think that beyond the fact that our population is aging, we have other trends in terms of who we're serving, who's going to need healthcare services today and into the future. The aging population is actually masking the fact that there are going to be about 70,000 more kids in this region in the coming few years, and they're going to need healthcare services as well. Some populations are not aging as quickly as others. The Aboriginal population, for example, is very young and is having more babies than many of the rest of the populations, and so we need to think about that. We know that we have an increasing population of newcomers to our region as well, and their health needs are a little bit different. So those are the kinds of things we need to think about as we think of how we will best respond to the health needs of our community. People's expectations are also changing. And when I say people, I mean not only the people who use healthcare services, but the people who fund healthcare services and our masters at the ministry, at the government, the politicians. There is no question that there's not much sympathy out there for the fact that times are going to be tough and it's hard and healthcare is complex. People want quality. They absolutely will not lower their expectations and say, well, it's okay if you slack off a little bit. People want high quality, excellent healthcare whenever they need it. And it's not good quality for people to not know where to go in the system and to have to shop around looking for the right provider. And it's not good quality to fall through the cracks when you're handed off from one organization to the other. And it's not good quality to have to repeat your story over and over again because providers don't talk to each other or don't work together. So our community, rightly so, is pushing us to do better. And their patience level is wearing thin, let me tell you. The other big force that's going to be at play in the coming years is the fact that there is not a lot of new money to throw at the healthcare problem. And in the past, we've been used to making investments and adding dollars to try to fix problems that have been long-standing. We've often done that without backing away from older, less efficient, less effective ways of doing. And so we've layered on additional costs to the healthcare system without necessarily always realizing the benefits. So we are going to increasingly need to make sure that every single cent is producing value for the citizens and the people who are using healthcare services, because we simply don't have the luxury to just throw money at the problem anymore. So these are just some of the challenges that we're facing. But when I try to sum up simply the work that we at the Lin and our partners are trying to do is really to try to change the fact that our healthcare system has not been built on a strong foundation of primary, home, and community care. It's not. We know it. And none of us should be surprised by that. Our system has been built around acute care hospitals and physicians. And there's absolutely nothing wrong with acute care hospitals and physicians. We need them, trust me, and we need them to do the best job that they can in this system. But if you go back to when our publicly funded health system started in the 60s, the very first provincial health insurance was a hospital insurance. And that served as the model for the Medicare and for the Health Care Act in the 1960s, in the mid-1960s. It was only a couple of years later that hospital care that was funded became physician care that was funded outside of hospitals as well. But if you think about it, if you're going to offer free health care in hospitals, people will go to hospitals. And if you're going to offer free physician care, then people will go see physicians. And that was the genesis of our universal publicly funded healthcare system. So that's our history and that's our foundation. And it probably made really good sense at the time. If you think of what people needed healthcare for, it was often acute, episodic, short-term illnesses. Think about a farming accident. Think about needing to get your tonsils removed. But that's not what ails us most today. And so 50 years after the introduction of Medicare, it's probably time that we rethink what constitutes healthcare services for an older, more chronically ill population. So we've been out talking to people, and we engage with our community and talk to people all the time. But recently, we had over 5,000 people hand us at the Lin a mandate for change. These people have said to us that there is urgency in our work and that we're going to have to speed up the pace of change. They have said to us, we need you at the Lin to work with your health service providers to do 3 things. We need better integration of healthcare services, we need better access, and we need you to sustain the core services that we want and need in our community. So that is not a small mandate, let me tell you. So really, when it comes to integration, we are going to need to focus on making sure that every single patient has an excellent experience with the health services they use across the entire continuum. Dean Kite in hospitality, you know how important, right, that good customer service is. Well, we can learn from that because we need to make sure that that client experience is excellent. And people will tell you how to make that excellent. People have said to us, if we need to use multiple service providers, we want those service providers to work as a single team. We don't care that there's 5 different organizations. To us, it should feel like one. They have no tolerance for, taking 2 years to adopt a common tool so that they don't have to be reassessed 3 times by different providers. They said we don't want to fall through the cracks when we leave hospitals and go back to our communities. So you need to tighten that up. You need to make sure that the hospital people are talking to the community people and vice versa so that we can get on with our recovery. So in the coming 3 years, we're really going to focus more on integrating community and home care services because that is a big area of concern from our community. When they find the Lin, and they don't always find the Lin, we're still not a household name, it may surprise you. But when they come knocking on our door, it's usually because they are fed up and they have been shopped around a lot and they are tired and they want somebody to put the pieces together and make their lives, which feel like separate puzzle pieces, to a whole that makes sense. We will be evolving the foundation that we have right now in this region on primary care networks. We have over 1,500 primary care providers working in this region who often don't really know each other and aren't well organized or equipped to share each other's expertise and resources. So we'll be focusing there. We also are going to have to be focused increasingly on how we look after people with mental health and addictions. That is one of the fastest growing health problems in our communities, and we are not ready to deal with it. I was shocked at the statistics. 1 in 3 kids is going to suffer from a mental health issue. Right now, it's 1 in 5 adults. Well, if our kids are starting life off with mental health and addictions conditions, you can imagine what those stats will be in 10 years. So we're going to have to roll up our sleeves and do better. In terms of access, we need to make sure that they are timely, that services are timely, and that they're equitable. There are still waiting lists for some services in our region, and that's not acceptable. So we're going to make sure that for some core services, we are reducing the time it takes for people to get access to services. And we are also going to make sure that we don't leave anybody behind. We have some groups of individuals who find it harder to access services or to access services that are culturally appropriate in their own language. And we have some communities where it's harder to get health services too. And I'm not suggesting that we will have all services in every single community across the broad region of Champlain, but we need to make sure that we're thinking smart about how to bring services. So for example, we're going to be pushing way harder on the use of technology. and this is where some of the programs at Algonquin College might in fact be helpful to us, we can do better with telemedicine, telemonitoring, telehome care, with self-monitoring as well. So there's a lot that can be done with technology where the client doesn't have to travel to go see a provider. We can bring the services to them virtually. We could be connecting our professional community way better by leveraging things like electronic consultation, where a family doctor can pose a question to a specialist and get an answer, and the specialist never has to see the patient. Or if he or she does, he can say to the family doctor, make sure that patient has had this blood work or this test done before I see him or her, so they don't have to have a second visit and repeat all those. We will be looking at more culturally appropriate care. We're doing some work right now with newcomers to try to better understand the challenges they face when they first come to our community and try to navigate the maze of a system that we have. I was teaching a mini med school recently, and I said, if you were going to design the healthcare service system from scratch, you wouldn't do it exactly the way it looks today. And particular focus on First Nations, Inuit, and Métis people who have by far the worst health outcomes of anyone in our community, and we need to pay more attention to that. And we are going to make sure that we're meeting our performance targets. As an agency of government, we are entrusted with a big pot of money. Well, we're going to have to make sure that in return we meet the performance obligations that come with that responsibility. And then in terms of sustainability, we have to increase the value of the healthcare services that are provided and make sure that every service is still relevant, it's still producing the kind of outcomes we want it to produce, it's still efficient, or it needs to get more efficient. And we need to make sure that people are getting served in the right location by the right kind of provider. So I mentioned that we're over-reliant on hospitals and physicians, and that's by design. Well, we need to change that. And so we'll be focused, for example, on making sure that we're growing health links across our community. And if you haven't heard about a health link sounds like a really innovative thing, and I'm sad to say that it is, because we actually don't do this. But health links is a way of looking after the health needs of the 1% of our population that consumes up to 60% of our healthcare resources. And so HealthLinks is bringing together an interprofessional team around these very complex people who have 52 visits to the emergency department a year, who've been admitted 12 times, who have 19 different specialists, and appointing one person to be their main point of contact, to navigate and to coordinate everybody else around a common care plan. It's not rocket science, but we are not doing this. And we're banking on that, because if we can even have some modest improvements, like think 60% of that 2.6 billion is consumed by 1% of the population. That's 26,000 people in our community. Even a 10% improvement, it's not set the bar too high, even a 10% improvement will reap savings that we'll be able to reinvest in other types of services that are needed by everybody else. So we're really counting on all of you to get behind HealthLinks big time. We're also going to be investing more effort at offering more choices for individuals at end of life. We have more people die in hospitals in Canada than any other jurisdiction. Our rates are quite high here in Champlain as well, and that's not where people want to be for the most part. That's an expensive resource that isn't what people want. And so that's another area we'll be focusing attention. And then finally, you know that we've been at 4 years now into a different way of funding healthcare services. And this funding reform, yes, is about a different way of how we allocate resources, but it's really about quality. It's about driving better quality outcomes for the amount of investment that's provided. And so we're going to be continuing along that journey. I've mentioned before that we won't have a lot of new money to invest, but we need to harness that $2.6 billion that's in there and use it differently. And I do like to remind people that there has been a lot of investment in the last few years. It may surprise you to hear that we invested, this is just the funds that the Lins flow in the hospital sector, not other sources of funding. It's $308 million just across the 20 hospitals in our region over the last 8 years. That's about $38.5 million every year. We've also invested over $70.5 million in home care services through the CCAC and another over $50 million in community-based services. So there is money out there, and we need not think that we're hard done by. And we just need to do a better job of unlocking that money to do what it needs to do for our community. So there's no question in conclusion that in the future, and I'm talking like the very near future, like tomorrow, our healthcare services are going to need to be different if we're going to experience a different state of health and wellness in this region. And to get there, we in healthcare in particular, but all of you who affect health, are going to have to think differently and act differently. We're not going to be able to keep throwing money at the problem, and we won't be able to continue thinking of our own individual organizations and our own interests. We're going to need to put people and people who use healthcare services and their families at the center of everything we do. And we're going to have to hold ourselves accountable for doing that and ask ourselves, are the decisions we're making and the acts that we're taking in the best interest of these individuals, and not just paying lip service to that? And I think that's why the work that's being done here at Algonquin College to embed an explicit focus on health and well-being throughout everything it does is so critical to our collective success. And it's an approach that we'll be looking at very closely and learning from, because if an academic institution can do this, I'm sure there are other services or other sectors who could be adopting a similar way of thinking and a similar approach and trying to embed that lens throughout everything they do. So I thank you so much for your attention. It's so early. And I know some of you are not morning people, so I really appreciate that you're here and you've listened so patiently. And thank the college and Professor Jensen, President Jensen, again, for the opportunity to kick off this series and be here with you. And I think there may be time for questions. I think I'm actually like right on time. Oh my goodness, without PowerPoint slides, which is a miracle, because I always say I need the slides to keep me on track because I'm French. And it's genetically ingrained in me to talk a lot and with my hands. So I'm doing all right this morning. Great. And I believe that there's a process as well for people online to ask questions, and that Chris is going to read those out if they come. And if people do have a question, just put up your hand. There are 3 microphones, and it's important to use the mic so that people online can hear you. Good morning, Leslie.
Hi, good morning, Chantale. My question was around one of the last points you made, which you went over fairly quickly, which was around funding reform, which you said was really more about quality. So I'm wondering if you could expand a little bit on that. Were you referring to bundled care? Were you referring to clients-directed care? Were you referring to some of the stuff in the price report around population groups? What did that mean?
So the genesis of the funding reform, when it first started, targeted hospitals in the Community Care Access Center, because these were 2 of the sectors where we've got the best data to be able to start to measure and quantify things. It is intended to expand to other sectors, and the thinking there was, we should no longer just be providing a base amount of money to an organization and say, go off and deliver service. We should be tying the amount of funding we provide to the number and type of clients that they serve, and determining what's a fair price to provide a particular type of service. Because if you looked across the province, the same procedure or the same type of care, the variation in price was astronomical and not justifiable. And so by setting a provincial rate and saying, this is what it should cost to deliver that service, it's forcing organizations to look at, well, if my costs are higher than that, why is that? And maybe I'm delivering care that's inefficient. I could be learning from others how to do that better. Or maybe I'm not following best practices. And so with every type of care that's funded in this way, there are clinical handbooks that come out in ways to help providers deliver the best care possible. I am also talking, though, about thinking differently about how we allocate. So you're right, Leslie. Things like bundling payments. So the notion that if the money really does follow the person, well, it should follow them from hospital to rehab and home. And we should pay for that entire episode of care as a single episode of care and not fund the hospital, the rehab center, and the home care provider separately. So it's really trying to push the envelope on different ways of approaching how we fund service to drive a better quality outcome and expanding that to more different sectors.
Thank you.
Thank you. Good morning, George.
Good morning, Chantale, and thank you so much for sharing your vision. I commend you for the emphasis on population needs and the value for money proposition, which is so very critical today. I'm wondering if you could comment on two particular areas. The first is we have an emerging private sector in healthcare. We're seeing it in our region in various areas like psychosocial services, community services, physiotherapy. We're seeing the insurance industry take a greater and greater interest in funding models for these services. How do you engage that component in the regional planning exercise, for example, as an important factor in the overall system that we're trying to rationalize? And secondly, could you comment on the role of research in this transformation, where you see the emphasis? I know the academic institutions will be very interested in hearing those comments.
Thank you. Two excellent questions. I will be perfectly honest and say that we've not paid much attention up until now to those health service providers that are in the private sector. So think about, for example, if you need to have blood work done. Those are private corporations, but actually you don't pay for the service. They bill OHIB. But they're a partner out there that we haven't spent enough time, I think, getting to know and getting to understand. We have been focused on the 149 other service providers that we have a direct relationship with, and that's kept us a bit busy. But it's time now for us to better understand who they are, what they do, and what role they can play. Not only because people have choices and have options, but because there are services that are not funded through the public insurance that people are paying for themselves, and we need to understand what role that plays. And I don't know that there's a trend necessarily to have more of it, but I do believe that there's a differentiation, or there's an attempt to differentiate what do the publicly funded health service providers offer and what's in the realm of the private sector, and those lines have been blurred. If you think, for example, that some hospitals could offer in the past physiotherapy services for some of their patients who would come back to hospital in an outpatient clinic. Well, if anybody else needed physio, you had to go and pay for it yourself or out of your insurance. That's set up on an inequity in access to care, and you're starting to see that is changing. On the second question, I think research is incredibly important, and it's incredibly important not only to translate evidence into how we deliver care, but it's increasingly important as an economic stimulator and as an industry. In Ontario, we've not done as great a job as other jurisdictions of purposefully investing in research to develop products that are health related but that could be commercialized, and that we can drive an industry around jobs. So for our economic viability, as well as for translating evidence into better patient care, research is critical, and it has a really important role to play. And it's something that there's not been, I don't think, there's been less attention paid to. In Canada, I think in Ontario, we're hearing the Premier talking about a desire to really drive the research from a commercial perspective agenda further.
Thank you.
Okay.
Good morning. Thank you very much for an excellent talk. I'm Christine Troutmansdorf. I'm with the Colleges and Institutes Canada, so we're a membership organization that represents colleges like Algonquin across the country. So healthcare training is a huge part of that footprint of the training that is provided in our member institutions. One of the observations that came out of the Naylor report over the summer was that there are the problems that you're describing and the challenges that you're facing are common everywhere, but that an innovation is occurring, but it's occurring in pockets.
Yeah.
And that there are not the mechanisms for that exchange. I wonder if you could talk a little bit about how you plug into what's going on in other jurisdictions, and then what role colleges and training institutes could play in leveraging those and building those into the healthcare system.
Yeah, thank you. That's an excellent question as well. It is a challenge to stay on top of everything that's happening. And that's why we need everybody to be paying attention as well and seeding ideas to the Lin. That is, like I said, the beauty of having local people that you can actually talk to, is if you've heard of something or seen something, to please bring that forward, and we'll look into it with you. We do believe we have a role to play to help spread those innovations. We're well connected with the 14 other regions, so at least from an Ontario perspective, we have a better sense of, what's happening in Northeast Lin that might be applicable to our region as well. And so we do spend a lot of time, the 14 of us together at the CEO level and at the senior level, exchanging ideas and best practices, because we're all facing the same kinds of challenges. We're less well plugged in when it comes to, what's happening in Manitoba, what's happening in Alberta, and that's where some of you are actually very well connected, because you are on national groups, you're liaised with other like organizations, and so some of those ideas we would welcome, and I think the colleges have a role to play. I do meet on a regular basis with the academic organizations here, because you're in tune to not only what the students are looking for, what the community needs. You're usually a couple of steps ahead of the curve in anticipating what might be coming, and you're checking in to see, are we reading the environment right? So I learn a lot from talking to the academic partners in terms of what that will translate into when it comes to health service delivery. So encourage the dialogue, absolutely.
Hi, thanks for a very interesting talk. I'm Mark Hodenbaugh, the Executive Director of Partnerships and Applied Research. We are here at an educational institute, and do you think there are enough collaborations and partnerships and linkages between the Lin and our academic institutions? And if not, what do you think we could do to improve those, especially as we move forward on this Healthy Living Education Initiative here at the college?
Yeah, I think this Healthy Living Education Initiative that you're spearheading will increase the opportunities for us to partner and to talk about your goals, your objectives, your read of the environment, and how they match up with ours, and they should be very well aligned. Is there an opportunity for more partnerships? Absolutely. We've been exploring different ways that can be translated into. So, for example, we often hear from providers who may come individually to the Lin to say, I need to develop some training for my personal support workers, for example. And we say, well, have you talked to the college about that? Because rather than you developing that, maybe the college could help you. They already know how to develop curriculum. Why not partner? So we'll send people back to you. But if we also hear of 3 or 4 or 5 different health service providers who have the same need, then we'll pull them together and sometimes approach the college to say, do you think there's something that could be done here? So because we have a broad view of what's going on across our big region, we can sometimes help bring people together and connect them with you. And then I think for us, it's looking at where do we have goals in common that we can help be a partner with, and whether that's us directly or whether that's linking you to others in the health system that share a common interest, that's a role that we can absolutely play. No questions online? No? Okay, well, thank you. Thank you very much.
Thank you, Madame Leclerc. What a wonderful presentation, very timely. I certainly understand the sense of urgency that we face in terms of our healthcare and the complexities that you face with challenges with quality and service, and it's absolutely something that we can all relate to. I think of the words of John F. Kennedy, to paraphrase him, is that ask not what the healthcare system can do for you, but what can you do for your healthcare system? And because we're all in this together. As President Jensen mentioned earlier, we understand the need to promote and teach how to live a healthier lifestyle now and prepare a health and wellness workforce that will sustain the future needs of our community. So we've started thinking about how Algonquin can play an active role in the future of health and wellness. At this point, I'd like to invite my colleague, Dr. Barbara Foulds, to come up and share a few things, a quick overview of what we've been doing here at the college. Barb?
There must be something about being height challenged at Algonquin with the ladies. Thank you so much, Chantale. And as you've given us so much to reflect upon this morning, and I think one question certainly those of us in post-secondary education ask ourselves is, what role can we play in this evolving environment that's changing very quickly? And at Algonquin, we've pondered, as many of you know, for a long period of time on that question, and we feel that we believe that post-secondary institutions like Algonquin College can play a supportive role in assisting all our partners achieve their respective goals for a healthier community. So let me share a couple of examples with you of the role we can play in creating the kind of learning enterprises that will help to assist achieve those goals. And the learning enterprise may be a learner-driven enterprise, just like this restaurant, or our dental clinic, which provides basic dental care to our students, our staff, and our community. And then there are also partner-driven learning enterprises where our partner establishes a service that also serves at the same time as a living lab for our students. And at lunchtime today, Cheryl will open ProPhysio, our latest clinic in the Student Commons. Our folks are with us today. This clinic will provide an array of services to students, staff, and to our community, but at the same time, it's going to provide that living lab for our students in the occupational and physiotherapy assistant programs, massage therapy. So it opens those doors to create that living lab by having that partnership. And thank you very much. Another example I'd like to give you of a learner-driven enterprise is something, and Chantale, this is something we've worked on in collaboration with the Lin and local service providers, is to bring an adult day program into our new smart apartment. And Chantale mentioned the importance of technology. This smart apartment that we're building will simulate a real-life home environment for our students to be able to recreate and learn in those systems, but the opportunity to partner because there was a need in our community for adult day programs. And these may be folks who have some early diagnosis of dementia, for example. And so the community provider will run the program, will use our space at the college, will be able to integrate applied research and technology as we provide this opportunity for our student learning. And I'm very excited with this particular initiative. We're hoping to start in January. We're just starting to build the smart apartment as we speak. And, you know, gym students, culinary students be able to provide lunches and snacks for these 10 adults who will come to the smart apartment, our personal support worker students, our fitness and health promotion students, a variety of students that will have the opportunity to engage that perhaps they wouldn't have, and there's an opportunity for us to be supportive of the environment. I always go on a little bit beyond my notes. These examples, as well as our commitment to provide a healthy environment for our students and our staff, showcase the role that Algonquin is playing in to support those broad health outcomes in our community. Our true goal is to graduate individuals with the talent to influence behavioral change and the capacity to improve health outcomes. That's what we're here for. And we look forward to continuing the dialogue with all of you of how we can best support you in achieving better health outcomes in our community. And this speaker series is the introduction of those dialogues, the connections we make with one another. And I encourage all of you to continue that dialogue with us in the upcoming months. So thanks so much.
Thank you, Barb. Before I call up our last speaker, I'd just like to remind you there's still plenty of food. So don't run out here afterwards. Feel free to have a second or a third. I'd like now to call up Claude Brulé, our Senior Vice President of Academics, to share some closing remarks. Claude?
Thank you, Jim. And what a great dialogue we've had this morning. I want to thank you, Chantale, for being our guest speaker today and also for partnering with us on this speaker series to share ideas around the future of health and wellness in our community. Your remarks and at times your sobering statistics, combined with your clear mandate to improving access to, integration of, and the sustainment of health and wellness services, provide us all with a clear call to action for the betterment of the health and wellness of the population of our community. So thank you. I'd also like to thank Dr. Barb Folds and Dean Jim Kite for their leadership of the college's health and wellness initiatives, some of which you've heard here this morning. So today was a great start of a conversation, but we need to continue this conversation. And so I will encourage you to suggest topics and speakers for future events that we're planning for this series. We will be following up with all of you who attended this morning with a short email to get your feedback on what you'd like to see for future events. And so we'll welcome your suggestions. And on that note, we hope that you'll mark your calendar for our next event, which is slated for Friday, the 20th of November. Same time, same location, and same great food from our hospitality and tourism students and faculty. Our keynote will be Mr. John Fraser, no stranger to all of you in the healthcare system. He's the parliamentary assistant to the Minister of Health and Long-Term Care. Mr. Fraser will speak to us on the development of a comprehensive strategy on palliative and end-of-life care, a topic that sadly will become increasingly important with an aging population, as Chantale spoke to earlier in her remarks. So I hope you'll be able to join us for that event. And again, a formal invitation will be sent to you by email. Well, this takes us to the end of today's event. And as Jim mentioned, do stay if you can, continue to mingle and continue this dialogue. We do have plenty of food to help you with that. I'd like to thank everyone for starting their day with us and for helping to broaden the conversation for the future of health and wellness in our community. I look forward to seeing you next month. Thank you very much.